Hello, magandang hapon and maulan na hapon po sa inyong lahat. My name is Dr. Ana Yark Bondoc. Thanks for joining us today po. And we will talk about urinalysis o ihi po at bakit pinag-aaralan ang ating ihi. Okay? So our program is called Libreng Konsulta. So you're very, very welcome to ask questions po para i-consulta nyo yung urinalysis nyo to ihi nyo dito sa baba. Okay? Follow us po. We are on YouTube Live. We do have a YouTube channel, Dr. Ana York Bondoc. We are trying to reach 1,000 subscribers para po lumago naman po ang aming YouTube. Please join us. And kahit maulan po, let's learn something today about ihi or urinalysis. Okay, so let's go. Guide question number 1. Let's start with the letter na lang before the guide question. Dear Doktora Ana, masakit po ang puson ko. Parang mahapding umihi, kaya nagpa-telemedicine po ako sa isang doktor. At sinabi po niya magpa-urinalysis po ako. So ngayon, tomorrow, I'm scheduled to go to the lab. Dapat daw yung unang ihi ko. So ano kaya makikita po sa urinalysis at ba't nga ba kinokolekta ihi? Okay? So, question number 1. Ano nga ba urinalysis? What is the urinalysis? Okay? Yung urinalysis po, that is the examination of our urine. Urine analysis. Obvious ba? Okay. Sa ano po ito in the ano ho sa usapan po in Tagalog, it's called patingin niyo po yung ihi niyo o pa-examine niyo po yung ihi niyo, then you have to go to the lab. Okay, how will the urinalysis be analyzed? Ito po, I will explain this later. Ihi po kayo, it will undergo microscopic and chemical analysis po sa laboratorio, and then they will come out with the urinalysis report. Yun pong ibibigay sa inyong doktor so that we can know more about your condition. Next to the blood test, the urine test is really, and the chest x-ray, yan po ang tatlo. 3 of the most common examinations that they normally do. That's also a component po, along with blood pressure, of an annual physical exam. So marami po talagang nagpapatingin ng ihi. Okay, so ano ang ihi? Ano nga ba ihi? Bakit tayo umiihi? Gandang tanong. Okay, urine. Urine po is the means by which po linalabas po ng katawan yung yung soluble or the liquid portions po ng waste. Okay? Our urine is actually waste product po ng katawan. That includes excess na mga byproducts po ng mga nangyari po sa katawan natin. And we have to excrete that dahil that is poisonous to the body and that is waste. Okay? So waste product po yon. Katulad po ng ating dumi, ang ating ihi po is a waste product of our body. Our body is able to get rid of some toxins po through sweating, pero maliit lang po yon. So majority talaga ng waste products na soluble po or liquid form is through our urine. So, eto po, how does it work? First of all, you have a kidney, okay? Meron po, the linchpin of everything is the kidney. All right? So the kidney forms urine. Paano po yun? Ano? The blood goes to the kidney. From the blood po, dun po finifilter. They get the excess water, the excess proteins, the excess glucose, yung mga waste products po like urea, creatinine, myoglobin, lahat po yan. And lumalabas po, no? The kidney pulls it out of the blood. And then, yung malinis po, binabalik po ng kidney yon, and then it goes back straight to the body. So the blood that enters the kidneys may waste products, the blood that exits the kidneys malinis na po yon. And then the byproduct po ng prosesong yon is what we call our urine. Okay? And our urine, after the kidney, it goes to the ureter, yung dalawang tubes po, no? And then travels down to the urinary bladder. From the bladder po, o yung tinatawag po nating pantog, dun po tayo umiihing palabas. So that's how we have urine, and that is why we make urine. And we study the urine po to know more about the processes which are ongoing po sa ating katawan. So ano ba lumalabas sa urine? Okay? So, sinabi ko na nga po, may lumalabas na tubig, may lumalabas na waste products, may lumalabas na glucose, protina, red blood cells, white blood cells, lahat po yon makikita po sa ating urine. Okay, so why do we order a urinalysis? Ba't nga ba sinusuri pa ang ihi? Hindi naman ho ganun katindi yung pagsuri ng ating dumi. Though there is a fecalysis, but talagang the urinalysis will tell us a lot about the way our body is working, not only our kidneys, but yung buong proseso po ng ating katawan may be seen through our urine. Okay, bakit ba siya in-order? Okay, these are usually the reasons kung bakit ho in-order ang urinalysis. First of all, part of the general checkup. Talagang executive checkup, general checkup, kahit anong checkup, ihi. Okay? Number 2, kung masakit po, what is usually the reason? Very common po ang infection. So masakit ang puson, masakit po ang likod or flank pain, nagkakalagnat. Those are all reasons to order a urinalysis. Masakit po ang tiyan, yes. Namamanas, actually. Also, one of the reasons po, nahirapan huminga is also another reason to order a urinalysis. So there are lots of reasons. The most common po diseases that can be seen in a urinalysis, kidney disease, kasi talagang masusuri po natin yung ating kidney through the urine, kung nag-work well yung kidney. Various infections, yung mga UTI po na yan. Diabetes can be seen in the urine. Renal stones and renal problems, renal stones and cancer po can be seen in our urine. Okay? So, next point po na pag-uusapan po natin is, dali lang po, check ko lang. Okay. So paano kumuha ng urine sample? Okay, sinabing pumunta ka na sa laboratorio. Okay, what will you do? Okay, what will you do? How will you prepare? Fasting ba? Okay, number 1, walang fasting. Okay, there is no preparation for a urinalysis. You just go there to the lab. The best time po talaga is yung unang ihip nyo po talaga. Okay? Some people, umiihi lang po ng konti, then they get the midstream urine. Bakit po tayo umiihi muna ng konti, tapos yung midstream po yung kukunin natin? Kasi sometimes, hindi naman malinis, sometimes overnight, pinapadlaan lang ho yung WBCs ng konti, then we get the midstream urine. And then, after that, that is what we bring to the laboratory. Okay? So, pwede ho kayong umihi sa laboratorio mismo, or you can do it at home. Okay? So, usually, they would ask you po na umihi ng konti, then collect some more, and yun na po yung dadalhin sa laboratory. No need to fast. No need to take a bath. Though some people would like to wash po na, wala naman po masama. That is also good. Okay? So, letter C po, what would we see po in a urinalysis? Ano ba tinitingnan dito sa ihe? Okay? Number 1, first of all, people sometimes look at the color. Before we look at the RBCs, though importante lang yon, the color usually doesn't really tell us that much unless it's really, really, really yellow po. Kuminsan, pag red, may problema po yan, will go into the hematuria. Pag meron din hong orange, certain drugs and diseases po, no? But as a rule, you can't really naman tell 100% from the kulay na lang. Some people would say yung ketones, yung mataas ang asukal na amoy. And one thing very unique about it, halimbawa umiihi mga lalaki usually sa gabi po, no? Pagdating nyo sa umaga, linalanggam, good sign of glucose po yan and diabetes. So let's go to point number 1, which is RBCs. Okay, ano ba nakikita? Okay, RBC, blood. It's not normal to have blood in your urine unless may mens kayo. This is an important point. Kung may mens po kayo, kung pwede, ipansantabi nyo lang muna yung urinalysis muna after the menstruation. Though you can always tell the lab na kayo po ay rineregla. Okay? So, ano ba nakikita sa RBCs? Usually po, kung may dugo po, no? Number 1 talaga na iniisip talaga na maraming tao is stone. Urinary stone, very, very common po talaga, RBCs. kidney problems. And another thing po na hindi natin masyadong napapag-usapan is bladder cancer. And ano po, cancers of the urinary tract. Right now, it is not used for screening, ano. But definitely, kung may ihi po kayo sa urine and RBC, at lalaki po kayo or you're in the older age, you need to be screened for stones at saka po you need to be, maybe you need to have a conversation po regarding bladder cancer and cancers of the urinary tract. Okay? Another thing na makikita po talaga dito is white blood cells. White blood cells, yung tinatawag po nating leukocytes along with nitrites. Malaking ano po yan towards UTI. What is UTI? Urinary tract infection. May infection po kayo sa ihi. Most likely, if you have a lot of WBC cells, if you see pus, and then cloudy ang urine, you see pus, likely po UTI. Okay? Next po. Also interesting na malalaman po natin. Ayan, protein. Proteinuria. Okay. Bakit po may protina sa ating urine? Usually means that there's a breakdown somewhere in the kidney. May kidney problem po kayo pag naglalabas po kayo, most of the time, though I'm gonna tell you one, ng protina sa inyong ihi. And usually there's a part of the parang microscopic part po ng inyong kidney na may problema. The most common reason po for protein talaga is diabetes, okay? And that is a hallmark po of diabetic nephropathy. So, kidney, glomerular disease, problems po inherent in the kidney, diabetes po, sometimes lead poisonings, and there's a kind of protein that comes out po in a cancer, blood cancer called multiple myeloma. But kung may proteinuria po kayo, the first thing that I would investigate would be diabetes and the presence po of diabetic kidney disease. Okay? Next po na makikita. Ayan, casts. Casts are things that are seen under the microscope. Meron pong WBC cast, UTI, RBC casts po. And iba't iba pong cast. It's a little technical, so wag na po natin, but basically microscopic po siya. And then next, the urine culture. Ba't nga ba tayo nag-urine culture? And what's the meaning of urine culture? Okay? Kasi usually, magkasama yan. Pag may suspect na UTI, culture po yung ihi nyo. What's the meaning of culture? Okay? One of the reasons that we do cultures po, it's to find out po kung ano po yung mikrobyo, what is the bacteria in your urine, and number 2, what are the antibiotics that we should use para po we can treat this bacteria. Okay? So, pag may positive UTI po kayo, in other words, you have WBCs, you have pus, you might have nitrites, leukocytes. Kina-culture po, no, they grow the urine in the lab and they see po kung ano po yung bacteria in your urine, and then they will test the antibiotics to find out po if the antibiotics kaya pong patayin yung bacteria na nasa ihi nyo. Okay? So yes, UTI is very serious. Usually, for those na wala po sa ospital, a UTI can usually be cured naman po with oral antibiotics. But sometimes with the elderly persons, people with blockages in their kidneys, people po in the ICU, they have more serious UTIs po which can actually cause sepsis or pumunta na po from the urine to the blood. Nangyayari po yan. And that can be very serious. Okay? So next po. Common interpretations ng mga sakit sa ihi. Okay. So ano ba mga common na sakit? Tingnan natin po, what do we expect po in UTI? I think I told you this na, no? Aside from the physical symptoms po, balikan natin yung sulat, masakit ang tiyan, ang puson, masakit ang side, ano po, nagkaka-fever. Sa UTI po, usually commonly seen, would you mind to project UTI po? WBCs, pus, white blood cell cast po. So, yun po yun. And then, proceed po to urine culture. Okay? So, yun po yung nakikita sa UTI. For the next po, buntis. Okay, bakit nga ba? Ang ganda ng buntis, ano? Yung mga buntis, Reyna, we use the urine to detect po kung buntis ka o hindi, no? Um, it's one of the earliest tests po if you are pregnant. Tumataas po, there's a certain protein in the urine po which goes up. So tumataas po yan, and that's frequently a component po of our pregnancy testing. Okay? That's why urine po yung pregnancy testing natin. As you proceed along your pregnancy po, people do tests for proteins, ketones, and bacteria and blood cells. Proteins, I mentioned for the diabetes kasi baka diabetic ka. Glucose again for the diabetes. And the proteins po, very interesting, pre-eclampsia. Yung mataas po ang presyon, hypertensive in pregnancy, can be detected po through their urine. So, minomonitor din po yan ng mga OB. Okay? So, what else? Other than pregnant, kidney stone, as I mentioned, kung may RBC po talaga kayo, tapos masakit yung likod nyo, and you know that you're not drinking a lot, kidney stones. Kidney stones po talaga. Kidney stones, very common. Okay, diabetes as I mentioned, ano? Maganda kwento ng mga diabetic po sa ihi nila. One of the most frequent na binanggit ko po, no, pag umihi po ang lalaki sa gabi or even ang babae, pag nakita po nila na linalanggam po ang inyong ihi, that is a sure sign of diabetes. This is an ancient test, panahon pa po ng Egypt, Pharaohs and whatever. Alam na po nila na talaga pong diabetes, ants, and urine. Okay? And there is definitely may amoy po talaga ang ihi po ng may diabetes. It's something else. Okay? And you will not forget that. Another thing po sa diabetes, yung ihi ng ihi sa gabi. Okay? Ihi ng ihi po sa gabi. At least 4 to 5 times a night. This is why is this? Mataas na po yung asukal nila sa dugo. They are spilling glucose, literally sugar, into their kidneys. It spills out, and then it comes out in the urine, and it frequently produces po yung nocturia, frequent urination po sa gabi. Kasi talagang yung ano nyo po, yung tindi po na asukal nyo, kailangan yung ilabas. So that is what will cause you to go to the bathroom very frequently, and yun nga, kasi may asukal sa ihi nyo, talagang, ayan, puntahan po siya talaga ng langgam. So, diabetes, yun po ang kwento ng urinalysis with diabetes. Frequently, they have UTIs, so may WBCs. They may also be having diabetic nephropathy, so they would have proteinuria. So, yun po yung mga makikita po sa mga diabetes. Letter E, I think I placed walang ihi. That's a problem. Paano kung yung wala ka ng iniihi? Well, that is a sign of kidney disease. It can be acute or chronic. Pag as we mentioned, di ba we had a guest, si Dr. Dondo, nakadialysis po. Ang mga tao pong nakadialysis ay hindi na po gumagawa ng ihi. So what is the job po of the dialysis? The job of the dialysis, parang yun yung magiging artificial kidney mo. As Dr. Dondo Corpus, a nephrologist, explained to us last month, because it was diabetes and kidney month po, no? So, the dialysis machine, it will get the blood from your body. It will go through the filter. Ito pong filter na to is somewhat like your artificial kidney. At dun po lalabas yung mga hindi po tamang mga substances sa katawan, and then binabalik. So it's called an arteriovenous fistula. From the artery po, it's pumped out, it goes through the dialysis machine, and then it goes back to your heart as in the vein. So yun po, no? So the dialysis machine acts as your kidney. So wala ka ng ihi. But as Dr. Redondo told us, mas efficient po talaga ang sistema po ng katawan natin because our kidney works 24 hours of every day. So talagang habang natutulog tayo, nalilinis po yung we produce urine, nilalabas po natin. Ang dialysis every 3 days lang po. So by the 3rd day, talagang hindi na po maganda yung situation nyo. There's a lot of waste products in your body. And if you don't get dialyzed, baka humamatay kayo. I don't want to name names, but our former president missed 2 dialysis sessions. So big problem po yan kasi may fluid overload na po kasi hindi siya umiihi. So nag-build up ang fluids and waters. And of course, waste products from the body would build up. So you have to undergo dialysis kung hindi ka na umiihi. So ganun ko kahalaga ang ihi ng isang tao. Okay, there is acute naman po na hindi umiihi. So yun po, that's what I mean chronic, matagalan na pong kidney disease. There is acute injury to the kidney which can happen po with an infection, with sepsis, with cardiac problem, na-dehydrate biglaan po. And sometimes, parang mini-measure po natin yung ihi natin, di ba? Reina, have you ever admitted a patient and then you keep measuring? I-measure nyo yung ihi nyo. Ayan. Kasi po, pag kumukonti
Yes
po yung
po.
ihi natin, yes, we could be dehydrated. So, kailangan po natin ng IV fluids, di ba, Reina? Or pag ihi naman po tayo ng ihi, baka po tayo naka-fluid overload. So, aside from the urinalysis, the color, the quantity is also important, especially for hospitalized patients. So, yun po yung kwentong urinalysis. Ang ganda, no? So, you don't know this. Ako din, it was a good review for me. So, sa inyo po lahat, mahalaga ating ihi. Urinalysis will tell us a lot of things about our body, not only about our kidneys, but also about our entire body and how it's working. And definitely, you need to urinate. Kailangan po nating umihi. Otherwise, it's a sign of kidney problems. So, kung sinabi po sa inyo ng doktor na magpasuri ng ihi, please do so. Okay? So, magandang hapon po and I'm welcome to answer questions po about ihi.
Okay. Miss Kat? Kimberly Blanco Gutierrez. Hi, Doc. My WBC is 4 to 6 HPF. What do you think is the problem?
Ma'am, ito lang we do not interpret the urinalysis based on the urinalysis alone. Hindi po yung, it's not like how do I put this? Di ba X-ray, there's a reader of an X-ray. Wala, and there's a reader of an EKG, ganon. But there is no reader of a urinalysis. So what does this mean? It means that we can interpret po one's urinalysis based, it's only one aspect na malalaman po natin. We need to know how you're feeling, may lagnat po kayo, history, and then after that po, there's a physical exam. We need to know if you're pregnant, kaano po ba. So, I would say if your urine has WBCs, you are masakit pong umihi, masakit ang puson like this person, then likely po you might have a urinary tract infection. Again, no, as Dr. Dodge said, at ang dami na natin pong urologist dito, ang UTI sa babae is very frequent and normal. Ang UTI sa lalaki should be worked up. Lalo na the second or the third time. So, ma'am, I don't want to give pronouncements based on a number alone. You have to put together your history, your physical exam, and then the urinalysis results, and then come up po with the solution kung ano po ang inyo pong problema. But thank you for sharing. Likely naman po, likely ha. Kung marami po kayong WBC sa inyong ihi, likely meron po kayong UTI.
Doktora, sa LTO, bakit ang hilig nila sa ihi?
Diyos ko, tama yan. Alam mo, naka-interview na ako ng mga eto lang eto, sa LTO, the reason that they ask you to do this urine test, not because they want to know if you're pregnant or if you have a UTI, drug testing po. And I think I did something about drug testing. Di ba I told you, the urine and the kidney filters out the substances in our body na hindi dapat doon. So one of them po is the drugs that we're taking. Ano po, lalabas sa ihi natin po yan. The bad thing about the LTO, after 2 days po, if you normally stop taking drugs, hindi na po madedetect sa inyong urine. So, yun lang po talaga. That's why sa mga Olympics, may Olympics pa naman next week, ang drug testing is random. Kasi pag alam mo na yun yung araw ng drug testing mo, then hindi ka na magagamit ng drugs for 2 days, negative si drug test. Another good kwento. Sa LTO pala rin, they give a substance so that they know na ikaw yung umihi. Kung hindi daw, I think you turn blue or something like that. Or if you try to use another, meron po silang ginagamit that would turn it blue or magkakaproblema po. Kasi talagang if you submit someone's ihi, yun yung analysis ng taong yun. Or yung drug test niya yung malalaman, hindi yung iyo.
Question from one of our viewers, Doktora, nakaka-affect po ba ng urinalysis ang may mens yung dinadatnan po?
Ayan, that's a good question kasi it's a very good question kasi po, di ba I mentioned yung hematuria and WBCs, pwede talaga maging red yon lalo na kung malakas yung flow mo and it just so happened, ano? So, if you could wait for a few days, then that would be good. Kung hindi naman po, please inform the lab that you are menstruating.
Doktora, umihi ako ng dugo or at least it was red.
Well, if you're a lady, I'll ask you rin kung may menses kayo. Kung lalaki po kayo, well, then that's another issue. And blood, another reason, nabanggit ko na yung kidney stones, hematuria. Also, pag umihi, bladder cancer. Another thing that's very interesting, very common ito, Reyna, the medication po na INH for anti-TB. Actually, we monitor if people are taking their TB meds po, if their urine becomes orange. Okay, wait, i-check ko lang If you are not taking your medication for TB, then your urine won't be orange. So yon, that's sorry. It's not INH pala. Okay? Rifampicin. Kasi three drug regimen. Sorry, ang dami lang po talagang nagka-fly dito. 3 drug regimen po ang tuberculosis. So rifampicin po it's usually in the same pill. So rifampicin po turns your ihi orange. Okay? So if you want to find out if your patient is taking the medicine regularly, kwentuhan lang po kayo and ask them kung ano po ang kulay ng kanilang ihi. Okay?
Doktora, may nakikita
bumati naman tayo ng konti after this, ano?
Doktora, may nakikita ba ang doktor sa ihi ng mga diabetic?
Ay, ang ganda niyan. Kasi, di ba, as I told you talagang, protein in the urine is very important sign po of impending kidney problems. Very important. Also, we do not, normally, we check naman po yung FBS, tsaka po yung, yung glycosylated hemoglobin. But kung talaga mataas, lalabas po sa, the glucose will come out in your urine, as I mentioned po.
Hello? Yes po. Doktora, masama ba yung ihi ng ihi?
Well, baka naman kayo inom ng inom. Yun din, ano? If you're really drinking a lot, then you're going to really urinate a lot. And napag-usapan din na po natin yung how to be able to sleep at night. Try to stop drinking po at least 2 hours before you go to sleep. Pero if you're not drinking, pero ihi pa rin kayo ng ihi, then it's time to investigate po talaga yung inyong diabetes. Wala ba tayong bumati? Ayaw niyong bumati o wala bumabati? Nalulungkot na ako.
Ito muna po, Doktora, and then let's greet po some of our viewers. Doktora, bakit yung dami ng ihi ay parating tinitingnan ng nurse sa atay ko? Sinasalin pa nga namin.
Siguro she meant tatay, baka wrong spelling na lang. Ikaw, Reyna, have you been a room nurse na talagang, di ba, people are like focused, ilan na ho inihi?
Actually, hindi lang, totoo po yan, Doktora. Sa catheter, tinitingnan din po namin, tinatanong namin nakailang banyo na po si patient. Pati sa mga babies, lalo na sa mga babies, yun po
Yeah,
talaga.
mga babies also,
Yes,
yeah.
po, nakailang diaper, nakailang ano po, kung nakailang, kumbaga dapat equivalent po yung ininom nilang milk dun sa iihi nila sa diaper. Yun po.
Tama yun. That is very correct. One of the ways that we can find out if a person is dehydrated or a patient is dehydrated is the amount of urine po that they will produce. Ngayon, kung hindi po sila umiihi o talagang kulang po yung ihi nila, one of the things that you can find out if their kidney is okay or if dehydration is the problem is to give them a fluid challenge, usually through IV. Pag binigyan niyo po yan ng swero at umihi, that's usually good. Pag binigyan niyo po ng swero at hindi umihi, usually bigger problem. Another reason that we measure po the amount of urine is when we are diuresing a patient. What's the meaning of diuresing? Yung bang overfluid overload si patient, tapos bibigyan po natin ng Lasix, papaihiin natin kung maiihi niya po lahat ng fluid sa kanyang katawan. Again, that's a good sign na nakakaihi po yung tao. Kasi pag hindi po nakaihi, ang labas niyan is dialysis. Kasi we need to remove the excess fluids. So it is very important that we monitor the amount of fluid. And usually, kung hindi naman masyadong serious yung pasyente, okay lang naman tinatabo with the number lines, that's okay. Pero pag talagang serious na po yung issue at hindi na humalaman kung umihi sa diaper or hindi talaga umihi, then it's time for a urinary catheter. Okay, what's a urinary catheter? O yung tinatawag po nating sonda. Yung pagsusonda po, that's a very thin, parang rubberized. It goes straight po to the bladder. The way I'm doing this, that's how you feed a catheter in, So male and female po, sinusonda po yan para po malaman po natin talaga kung ano po yung status po ng kanilang ihi. Okay? Very important talaga ang ihi, Reyna. Super.
From Mr. Mar Mangalos Lansangan, watching from Milan.
Wow, it has been a while. Sir, how are you? And I hope na bakunahan na rin po kayo sa Milan.
From Miss Florita Solis, I'm watching from Bataan. Keep safe po.
Hi, ma'am. Kumusta po sa Bataan? Thank you.
From Mr. Kevin June Ocampo, shout out naman po. Keep safe and God bless.
Kevin June, thank you and shout out.
From Miss Mylene C. Handi, good PM po, Dr. Ana.
From Mylene.
From Shams Chelsea, good PM po, Doc.
Sham, kumusta ka?
From Jasmine Manalo, hi Ana.
Oh, that's my classmate, Jam. Kumusta ka? This lady is in Houston. She is a very, she's the top of a physician practice group. Ang taas ng position ni Dr. Jam. She's my classmate and a really good doctor and an excellent administrator.
From one of our viewers, Doktora, may issue ba sa kulay ng ihi? Ayan, ang ganda ng tanong, Doc.
Sometimes, yes, I would say there would be yes. There's an issue sa kulay ng ihi. Kaya lang, it's not absolute. Okay? It can give you clues, but you cannot rely on it. Like yung red nga, baka may dugo. Pag medyo cloudy, baka may UTI. Kung ano naman po, kung very dark, baka meron tinatawag na breakdown product kasi ang myoglobin, it comes out in the urine. So lumalabas po si myoglobin. Have you ever, Reina, di ba, have you heard of yung mga fraternity na nagbubugbog ng mga, ng mga neophytes? Okay. Very common dito sa mga to dahil binugbog sila, nagkaroon ng muscle breakdown. Sa pagka-muscle breakdown, the myoglobin or the one of the pigments in the muscles comes out. And then lumalabas siya, kasi from the breakdown of muscles, lumalabas siya sa ihi. So these kinds of people na nabugbog, ang ihi po nila is dark. Okay? Ang ihi po nila is dark. Again, I mentioned those on TB therapy, the ihi is dark. And yun po yun, those po with excess bilirubin also can have dark ihi. Yung sobrang light ihi naman, sabi nila po yung masyadong uh, talagang sobrang colorless. Sabi po nila, so I never really bank on this. Sabi po nila yung talagang masyadong dilute po yung ihi nila. Kaya lang I've never really, hindi ko siya talaga sinusunod na, oh my God, ganon. Hindi po. And that's pretty much it. Black urine, wala pa akong narinig. Dark urine, meron. Yung dark urine nga yung binugbog. Ayun.
From one of our viewers, Doktora, bakit parating kumukuha ng urinalysis sa buntis?
No, ikaw, Reyna, you've been a mom, no? Daming urinalysis na
po.
inaano.
Almost every month, siguro lalo na pagka may...
Oo, may yes. That's also to detect, yun nga, diabetes, high blood pressure, pre-eclampsia, UTI, kasi eto maganda to, one of the most, one of the most, one of the most common reasons for for premature birth or miska ay yung maagang UTI. So something to know about.
From Miss Gemma Abaricio sa Turay. Good afternoon, Doktora. Kaya pala nang magpa-urinalysis ako, sabi ng doktora ko, maganda daw kidney ko, liver, okay ang result ng urinalysis ko.
Yes, Ma'am Gemma, your urinalysis, a normal urinalysis is a good sign and it is a sign of good health. Congratulations, Ma'am.
Okay, from Miss Maria Nenita Lingha, saan po averages nag-uumpisa ang diabetes?
Saan po average nag-uumpisa ang diabetes? Are you asking me age, ma'am? Age ba? Ito, puntahan na lang natin yung age. What is the average age that people normally get diabetes? Okay? Diabetes can be divided into two. Let's talk about type 2 kasi yun po yung most common, ano? And this is also very much hereditary in nature. But may component pong malaki about what you eat and how you eat. Okay? So, what I could say, no, nung unang panahon, nung nag-aaral pa kami, we always were taught that by the age of 40 to 50, even 50s, ganon, kung meron ka talagang predilection, obesity, family history, not eating well, by the time you're 50, you have diabetes. But now po, no, because of the sedentary lifestyle, I'm sad to say, of course, hereditary. Number 3, yung bad diet talaga po, bad diet. I am now seeing diabetics in their 20s and overweight, obese. So may diabetic na po sa kanilang 20s. Ngayon, it is frequently said that by 15 years, after 15 years that you started your diabetes journey, kung hindi po talaga kayo maingat, may bibiga, usually the kidney. So, if you've been diagnosed, say at age 30, by age 45, may problema ka na sa kidney mo, especially po kung hindi kayo mag-iingat and you don't monitor your sugar. So I hope that answers your question, ma'am. So usually, people say 15 years, but if you don't take care, worse pa po yung mangyayari. So 15 years after the not after the diagnosis but sometimes kasi na-diagnose late. So parang lumampas na yung 15 years. But 15 years, yun. But now there are diabetics in their 20s, so by 40, dialysis na yan.
From Miss Carmen Doloiras, when do doctor needs to request 24 hours creatinine clearance test? What gave doctor decision to have that po?
Ay, maganda yan. And I decided po not to discuss the creatinine clearance kasi medyo po yan eh. Mas technical po. But anyway, ganito po yun, creatinine clearance usually tells us po the function of our kidney. What is creatinine? Creatinine is the substance na usually we use to monitor. Usually there are two, BUN blood urea nitrogen and creatinine po, we monitor that in our blood. It is a blood level, okay? So, ano po yan eh, makikita po how much it's cleared in the urine. Ngayon, there is a, ano po, there is a way to do this. 24 hours po tinitingnan yung creatinine po sa ihi natin. And then, tinitingnan po, it's correlated with your age. And then, usually, malalaman po natin yung structure po ng ating kidney based on that. Though there is now a computation yung creatinine clearance kasi kung yung iba hindi na ho na kumukuha ng 24-hour. Kasi meron pong something based po on your body mass and on your age and on your blood level. So, dun po nakikita. So, creatinine clearance, it's a measure of kidney function. And pag bumababa po yung inyong creatinine clearance, ginagamit po yan ng mga nephrologists to let us know there are warning signs, 50%, 15% na lang po. And then they will decide po whether or not you need dialysis. So yun po yun.
From Miss Carmen Doloyras, what are ketones
Yes,
in urine? What does it suggest?
Naku po, not good. Ang ketones, ma'am, pag may ketone ang urine mo, that means you are going into DKA or diabetic ketoacidosis. It is not a good situation po talaga. What is diabetic ketoacidosis? Yun po yung masyado na pong mataas po yung asukal nyo po sa katawan that you are now starting po to produce ketones. And that is, your body moves from aerobic to anaerobic metabolism and it is not good.
From Mr. Daniel Lopez, Doc, I drink 3 pitchers of water with lemon every day. I am 58 years old and it helps begin my health. Just want to share. Thank you.
Wala naman pong masama doon. That's good. In fact, I'd like to say, kasi sometimes, we keep drinking mga soft drinks, tea, coffee, energy drinks, lahat po yan. Hindi tubig yun, okay?
From Miss Emmy Lakap, Doktora, madalas po akong umihi. Medyo masakit po balakang ko. Palipat-lipat po sakit ng balakang ko naman.
Ma'am, magpa-urinalysis kayo. That could be, that could be helpful. Kung normal po, then you can just relax yourself. Opo. Again, kung may problema po, urinalysis is usually a very good first step. Even before ultrasound, lahat po yan, pa-urinalysis lang po kayo. It's not expensive. But it can tell you a lot.
Okay, next question. From Miss Cindy Abinas Cantillo. Hello po, Doktora. Ano po ang medical term ng balisawsaw at bakit po ito nararanasan ng karamihan?
What is balisawsaw, Rina?
Dok, para po siyang yung ihi ng ihi, tapos minsan may lalabas, minsan wala, tapos hindi po mapakali, tapos inom naman po ng inom ng tubig. If I'm not mistaken, ganun po yung balisawsaw. If I'm,
you know why?
Po.
Remember yung kay this lady urologist, I'm starting to think that this is called frequent urination syndrome or yung tinatawag po ni ano ba pangalan ni ma'am? This really great female urologist, yung punta ng punta sa CR, yun, nalaman ko yun yung problema ko. Yun po yun. It's not necessarily you just really need to train yourself and train your bladder din po. You also need to regulate the amount of ihi and drinking that you do. Ang ganda nung remember ano ba pangalan ni ma'am? She was really a good she was a female urologist po. It's a urologic problem, yung balisawsaw. People do say doon that wag kang umupo doon sa mainit, kung hindi, I don't know if that is true. Let me ask that to Dr. Dodge when he comes back or Dr. Ryan.
Okay. Next po, Miss Kat. From Miss
Parang daming tanong. Oo.
Yes, na-miss ka nila, Doc. Na-miss nila ang ating
Hindi. May problema sila sa ihi. Okay, go.
Tsaka, Doc, most common talaga kasi yung pag nagkaroon ka ng health problem, sa wiwi talaga unang-unang nagkakaroon ng
Ay, nako, talagang, oo, nako, Diyos ko. Yung urinalysis na yan.
Doc, di ba kahit sa diet, doon mo malalaman kung effective ba yung diet mo or hindi? Sa urine?
Hindi, malalaman mo if you're losing weight and your diet is effective or not. Okay.
Yes, yes. Okay, next po.
Hmm.
From Miss Cecil Espiritu, good afternoon po, Doktor. Ano pong ibig sabihin nung nakalagay sa urinalysis? Sa result sa protein na trace, positive, positive,
At usually, ano ho, +1, +2, +3. Pag
opo.
umabot po kayo sa +3, problema. If there, yung trace, okay lang ho yun. Just repeat na lang po. Na ngayon kung dumadami talaga, then that's another issue.
Okay, next po. May next pa po, Miss Kat.
I think some people sent their urinalysis. Tanggalin na lang po natin yung kanilang name. And
Miss
then,
Kat,
tingnan po
kindly
natin.
po check
Okay?
po.
Please remove the name, ha? I think the first one was normal and the other one had uric acid. So,
Naku,
sige.
nawala po yata si Miss Kat. Let's take some question muna po.
Naku po. Okay lang.
Okay, let me check this one. From Miss Carmen Doloiras. Cecil po, that protein, Cecil daw po ang pangalan niya.
Ay,
Okay.
so sorry, Ma'am Cecil. Opo.
But I don't understand actually. Okay, let me just read it,
Baka
Doktora.
naman she's using the FB of her sister. Merong ganun eh.
Okay. Cecil po, that protein or albumin is like may trace po kaya na nagnanana, little infection maybe.
Pwede naman. Opo. Again, this is what I would caution to persons. We do not read the urinalysis based on the urinalysis alone. Okay? Bilang doktor po, there is a reason why we ordered the urinalysis. May iniisip na ho kami. Okay? Either diabetic ba kayo? May kidney disease ho ba kayo? May stones ba kayo? Meron ho ba kayong UTI? And then, the urinalysis confirms our suspicion. Yun po yun. So, we have to put together everything. Hindi naman ho talaga pwedeng sabihin na ganito lang ho based on a lab result. Ayoko po ng ganon. Though, of course, napopoint na po tayo in that direction.
All right. From Mr. Dennis Malingit Lopez. Good afternoon po. Miss
Dennis,
Kat,
how are you?
Doktora is requesting na ipakita natin yung urinalysis na nag-send.
Or yung ano na lang, yung abnormal part na lang ang pakita nyo.
Yes.
Parang yung isa normal eh. Oo. Okay, how to read your urinalysis, okay? Most of the time naman po, nakikita nyo naman hong negative, 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 then don't panic, okay? Kung meron naman hong positive doon, then just go to your doctor po and pag-usapan. Ay, nakita ko na to. I think the issue here was gout. Lumalabas din po yung gout dito po sa urines. But again, it's not the only way. So, patingin na lang po sa inyong doktor. Okay? I think I saw this. Opo. Okay, tama. Okay na po ito. And then yung the first one po, it's a normal urinalysis. So okay na po. Normal po yan. It's always nice to see normal. Ano po. But again, there are reasons that the doctor ordered that. So you need to go back po to your doctor and show them din po the results. Okay? Kasi hindi ko naman ho kayo na-interview sa bahay niyo.
From Miss Nep Hernandez. Hi po, Doc. Good PM po sa inyo.
Ay, thank you. Good afternoon po. Ay, from Bacoor si ma'am. Thank you.
From Miss Rosemary Tolentino Silvestre. Hello po, Doktora. Ganda po ninyo.
Wow. Okay yun.
From Miss,
ang maganda yung ihi nyo. Diba?
from Miss Carmen Caliulio. Good PM, Doktora from Macabebe, Pampanga.
Ma'am, good afternoon po.
From Miss Spenchen Bungay Malonzo. Hello po, Doktora. Watching from San Nicolas, San Simon, Pampanga.
Hi, ma'am. How are you dito sa San Simon? I hope you learned something kahit papano lang tungkol sa ihi nyo. First of all, don't panic about the urinalysis. It's just one component po ng inyo pong entire physical exam. But it's something to talk about and nice to know about po kasi it is often ordered.
Okay, from Miss Spensheng Bungay Malonzo. Maraming salamat po sa information, Doktora.
Thanks, Mom.
From Miss Jasmine Manalo. Thanks, Anna. You're too kind. I miss you.
Friendship ko yan. Not only that, her husband looks like James Bond. Okay.
From Miss Cecilia Espiritu, nag-antibiotic nga po yung pamangkin ko pero nawala na po pag normal po yung pus cells at RBC niya. Yung protein ganun pa rin. 7 days antibiotic po iniinom niya.
Yeah, that's a good thing to do. And then assess na lang po kung ano po nangyayari.
I think, Doktora, okay, last one from Miss Jasmine Manalo. What about tea-colored urine? Planted question.
yung mga orange colored or tea colored, sometimes liver problems. I mentioned rin po na yung myoglobin can look dark. And then again, tuberculosis po. Yan. Thank you for that planted question.
From Mr. Orly Tugo, very informative. I shared this live discussion.
Wow!
That's all that we have, Doktora, for today.
So, na-check ko tuloy lahat ng kulay ng urine, nakakatawa. But again, one also, if your urine is very concentrated, kasi may nakalagay specific gravity, no? One of those. That's also to tell if you're dehydrated or not. So, I normally don't really focus on the specific gravity. Kung dark na dark din po yung urine nyo, you might consider dehydration. Kasi ang meaning nun, concentrated yung kulay. Yun. So, sa inyo pong lahat, don't panic about the urinalysis. Just bring it back to your doctor and have a good talk po kung ano po pwede niyong gawin. How to improve your urine. Of course, you have to improve your general health. And of course, kung uminom po tayo ng tubig, sometimes we forget to do that. Okay? So, sa inyo pong lahat, magandang gabi na po sa inyong lahat. Thank you. Ay, tomorrow, we're talking about Pfizer. Ayan na. Okay?